Hi, welcome to Wellness Wednesdays. I'm Mollyann Allen. I'm one of the physician assistants at Norterra Family Medicine. And tonight we have a very special guest. Some of you may know him. His name is Dr. Jeffrey Greenberg. He's a cardiologist with Cardiac Solutions. He's been practicing here in the Valley for over 20 years. I have a lot of people that I've sent over the years and collaborated with him. So very trusted cardiologist here. I asked him to come talk to me and to talk to Norterra patients about the CT calcium score. I've been seeing him ordering it more and other cardiologists, and I've ordered it some on patients, and I just wanted to learn more about it, and I wanted our patients to learn more about it. So I'm going to start off by asking Dr. Greenberg just some questions about this test. So can you just kind of give us a general, like, what is a calcium CT score? What is that?
Okay. Well, first of all, thank you for having me here. Happy to help. So basically what a CT calcium score, it's a type of CT scan that we can measure plaque buildup in the arteries of people. It is a very good screening test, and it allows us to pick up the very beginnings of hardening in the arteries. In fact, it's very sensitive. It can pick up hardening the arteries 10 years before somebody has a heart attack, before they need stents, before they need heart surgery. So it allows people to sort of see how they're doing, see how they're feeling, and it gives a picture into their arteries. In fact, it's the best non-invasive test we have to get that information. So
who would be the ideal patient or person who would benefit from getting this done?
So in my opinion, anybody who's never been diagnosed with heart disease before, it basically lets people know exactly where they stand. So for most people, if they have coronary disease, it sort of lurks there silently until they have a problem, until all of a sudden they need a stent, until they need heart surgery or have a heart attack. And unfortunately, 25% of people don't survive their first heart attack. So anybody who already does have a history of coronary disease, it's not really beneficial. But anybody who is over probably 30 years old, especially people who have risk factors, people who smoke, people who have diabetes, people who have hypertension, people who are overweight, people who have family histories, all these people can benefit. And it lets you know where you stand. I mean, the absolute worst is you do the test and it comes back normal and you know your arteries are good.
Is this a test that you do in your office, or do you send patients to a radiology office typically?
So it does involve a CT scan, which we do not have a CT scanner here. Okay. So most of the major radiology groups here in town do have the capability of doing it. It is not covered by insurance. So we've priced it out over town. Currently, the cheapest price is $85, which is a cash pay price at one of the local radiology groups, which is actually a good price for a CT scan.
Okay. Is there an IV involved with this? Do you have to do IV?
Excellent question. And the nice thing is there are no IVs involved. It's about a 5-minute test. You just lay there. There's no IVs. There's no contrast, which means people who have kidney problems can take it. People who are allergic to contrast, since there's no contrast, they can take it. You literally just lay there for about 5 minutes, and then it gives what's called a calcium score.
Okay. And the only people really that shouldn't probably get it, I would imagine someone who's pregnant, right? Or probably wouldn't want to do that.
You would not want to do that, but theoretically you could.
Oh, you could. Okay. And then the only other person you said, maybe if they already have heart disease, you wouldn't want to do that.
Yeah, so because basically the test lets us know black or white whether somebody has plaque buildup in their arteries. So obviously if somebody already knows that information or they've had stents, it wouldn't add any new information to it.
Okay. All right. Are there like risks to getting it done?
So
procedure or any risks?
So the risks are very minimal. It does obviously involve a little bit of radiation because it is a CT scan, but it's actually less radiation than a mammogram.
Oh, wow. Okay.
So there is some radiation involved. So, people shouldn't be getting 20 every year. But every once in a while, it's a perfectly safe test and there's really no other risks besides the very small amount of radiation needed.
So what is, when you get, like, when you get your report, I know you get a score. And so how do you utilize that information, and what do the numbers mean?
So, and that's very important. So what it gives is called a coronary artery calcium score, or some people will call it a CAC score, CAC. And basically it's a measurement of the calcium in your arteries. So we should all have a calcium score of 0. We consider a small amount of plaque less than 100, a high amount of plaque greater than 400. A very high amount of plaque is greater than 1,000. The all-time record we've seen is about 6,900.
Oh, wow. That sounds like a big number.
So the nice thing is when they do report the score, they do report it by artery. So we have 3 main arteries, one down the front, one down the left, one down the right. And it'll actually let you know a breakdown between the 3 arteries where the calcium buildup is. And it gives you an exact number of each artery. And then they also give you a number when they compare you based on your sex and based on your age, where you rank compared to people in your age group.
And so how do you use this information with other markers for risk of heart disease? So like whether it's a lipid panel or some of the more advanced panels like LP(a), or do you just how do you take all the information or decide how to use it?
So that's actually the biggest part of it. So what I always tell people when they get the calcium score, it gives you a picture in time, meaning where are you right now? A little bit of plaque, a lot of bit of plaque. The big reason I like it is it allows people to make sort of mid-course adjustments. So if you know that you have plaque building up, but you haven't needed heart surgery, a stent, or had a heart attack, you can then make adjustments, whether it's improving your diet, whether it's increasing exercise, whether it's losing weight, whether it's improving your diabetes or lowering your blood sugar. So that's the most important thing. It allows people to know where they are, because if all of a sudden you're feeling great, but you find out you have a calcium score of 500, you know that it's developing, and you can then make the adjustments you need to keep that score from getting worse. We can also use that number to basically risk stratify people, which helps us decide medication-wise sort of what people need, what people don't need. If you have a calcium score of 0, that basically means you have no plaque buildup in your arteries. And obviously, prognostically, that is really good, meaning the chances of you having any acute cardiac issue over the next 5 to 10 years is extremely small. They've also done a study which was reported now, it was about 4 years ago, where they looked at people in the different groups, whether it was a calcium score less than 100, a calcium score greater than 400. And what they found is the benefit to cholesterol medications, such as statin medications, tend to be in those groups where the calcium score is very high. So sort of like any medication, the higher the risk you are, the more benefit you get. Those people seem to show some benefit. Whereas people who have low calcium scores, I think they ran the study for 9 to 10 years. Basically, there was no benefit to statin medication in the low risk category, meaning it did not reduce risk of heart attack, stroke, or death with the cholesterol medication.
Now, if you are currently taking a statin like Crestor, Lipitor, does that change your calcium score? So if you take the test while you're already on a statin, does that make it better necessarily, or how does that affect it?
That is an excellent question. And first of all, statin medications do not work by preventing plaque buildup. We know that for a fact. So taking statins will not keep plaque from building up. That's where diet, exercise, nutrition come in. Sort of surprisingly, statin medications have actually been shown to worsen calcium scores. They actually make the calcium score worse. So people can take that for what they want, but that is a well-known effect of statin medications, that it will increase calcium scores. And there's debate as to what that means.
So if someone takes the test and they're a 0 and they're on a statin, the 0 is still pretty valid, that's a good score. I mean,
absolutely. And again, the way I would say that to a patient who's asking me is that the reason to take a statin medication is not just to lower your cholesterol. That's just a number. It's to prevent something. So you're taking it to prevent a heart attack. You're taking it to prevent a stroke, to prevent death. And what they found in this group, this low risk group, is that whether you take the statin or not, no matter how high your cholesterol numbers are, it does not reduce your risk of heart attack, stroke, or death, which means whether you take the medication or not, statistically, your chances of dying from a heart attack or a stroke or death are basically the same.
Mm-hmm. Wow. It's very, very interesting. So if you have a higher score, potentially you might put on a statin. What are like specific like supplements or maybe non-statin things that you could do to improve your score, or diet, exercise, any specific things that help lower the calcium score? Can you lower it too?
So that is debatable. There's never been a study that has shown that people can do that. There are reports, though, of people reducing it. It's becoming quite obvious the biggest risk factor for coronary artery disease is not cholesterol, it's elevated blood sugar. Prediabetes, hyperinsulinemia, and by lowering your blood sugar, by lowering your insulin levels, you obviously decrease your risk of having a heart attack or stroke, but that has been reported by people who do this, who get their numbers down low, that they can keep the calcium score from getting worse. And that's actually a very good prognostic factor. So let's say we do a calcium score and you repeat it in a couple of years and the number is basically staying the same. That's a very good prognostic sign that you're doing well. But having elevated blood sugar, being a diabetic, is really bad for increasing calcium scores. So if people are looking to improve, they want to get their blood sugars down. And one of the best markers on a lipid profile, believe it or not, is not the LDL, it's the triglycerides. And getting those triglycerides down low, well below 100, is one of the best things you can do statistically to lower your risk and to keep the calcium score from getting worse.
Oh, yeah, those blood sugars are definitely a problem. And well, that was very interesting. Anything else you think we should know or about the CT calcium score that you didn't mention, or anything else that you want to share that you think is important about it?
Well, the most important thing is it is basically the best non-invasive screening test we have. It's the only test we have where you actually look at the arteries that will tell us, again, whether there's plaque buildup or not. Stress tests do not give us that information. They're not sensitive enough to pick it up. An ultrasound is not sensitive to pick it up. Doing a full angiogram or a heart catheterization involves a heck of a lot more radiation, and it's also a heck of a lot more expensive. Those are in the cost of the thousands, whereas you can get a calcium score now for under $100. So to me, it seems like most any adult, it can't harm to get a calcium score. You do need a prescription from your physician. As of right now, you just can't go and get it done. You need a prescription to get it done. But to me, there's very little downside for people to find out sort of where they're at. And the reason I like it is what I tell my patients. It helps me guide them going forward. So as far as what you need, what you don't need. And again, it tells people whether they're headed down a good path, whether things are going well, whether they're headed down in a bad path. And again, it's powerful enough to give people results so they can know literally a decade in advance whether they're headed in a good place or not. And the hope would be that if people do get, bad information, that they can then make life adjustments as far as improving their health, whether it's losing weight, whether it's improving, blood sugars. On the other hand, it can tell people who are doing well, it can reassure them what they're doing is working. And it can also reassure their physicians that they're headed in a good direction and they don't need to be overly concerned about their heart at that point in time.
So my question for you then is also, if I'm referring a patient to see you, do you prefer for me to order it if I think it's appropriate before they see you, or do you like to see them first and decide that that's the best test? Do you have a preference?
Yeah, usually I just leave it to us, because obviously we sort of look at the whole situation, and especially if there's some kind of symptoms, usually we would run a stress test first because that would rule out anything bad going on. Because if there's a abnormal stress test, a better procedure would then be a CT angiogram or a heart catheterization versus doing a calcium score. So, but for an asymptomatic person, for people who has risk factors, I would have no problems. And I do get a lot of referrals from that from primary care doctors who've sort of seen what we've been doing, and they'll order a calcium score, and somebody completely asymptomatic, and they'll get a calcium score of 800 and then refer it to us. So.
Okay. So if they're kind of just more of a screening, maybe it's good, but if they're a little bit more higher risk or have had some concerning symptoms, better to wait, talk to you and figure out what the best test might be.
Yeah, I would do that first because sometimes we might decide, at least initially, to go in a bad direction. And a lot of times what will happen, people will come with some weird symptoms, some atypical chest pain, some shortness of breath. We'll do a stress test just to make sure there's nothing major going on. And then if that's good, then we would consider doing a calcium score just to further risk stratify going forward.
Well, that was very interesting. Thank you so much for teaching us more about this test and a little more confidence here on ordering it. And so I'm excited to try it on more patients. And yeah, thanks for it seems like a great tool to kind of assess what your risk for heart disease might be in the future. So
it's an excellent tool. I think most people should at least get one to see where they're at.
All right. Well, maybe I'll get one done. Well, thank you so much for your time. I really appreciate it.
Thank you.
Okay. Have a great rest of your night.
Thank you.
Thank you.